by 65% of preschoolers. Well, I'm actually talking about 4 to 5-year-olds. It's a new report that says they're not expected to reach their early learning and physical growth standards. Now, that's according to a survey by Thrive by 5 Index, assessing over 5,000 children enrolled in various early learning programs. Let's find out what's actually going on. Sonja Giese from the Index joining us this morning. Sonja, hello to you. I mean, that's very, very worrying. We're going to talk about why that is in just a moment. But first of all, just tell me about the research. Why do the research and what were you hoping to achieve with this?
Hi, Gareth. Yeah, good morning. So the Thrive by 5 Index was initiated because we have no data in South Africa that tells us how children are starting school. We place a lot of emphasis on assessing how they progress through school, how they finish school, whether they get employment. And we know that all of these things depend on their experiences that they have in the first 5 years. So in partnership with FNB, the Department of Basic Education, Innovation Edge, USAID, and other stakeholders, we initiated the largest survey of preschool child outcomes ever undertaken in South Africa. And as you say, we assessed over 5,000 preschoolers across the country, and we looked at 3 areas of development that are predictive of success in school and beyond school. We looked at early learning, we looked at physical growth, and we looked at social emotional functioning.
And the worrying part is this has probably been going on longer than just since the survey came out, because you've only initiated the survey recently. But now that we know what the issues are, which we're going to touch on now, I'm also going to ask you to tell me what do we do about this. So when we talk about not expected to meet their early learning and physical growth standards as well, how quickly can we get on top of a problem like this?
No, that's a great question. So because of the way children develop so rapidly in those early years, it's a period of great vulnerability. So we can do a lot of damage to our children, but it's also a period of enormous opportunity. So we actually can turn this around. For example, one of the things we looked at was stunting. Now, stunting is a preventable condition that results from chronic malnutrition. If we introduce the right kinds of interventions during pregnancy and in the first couple of years of life, we can reduce stunting significantly. And we also know for early learning, children are not able to do the basic tasks that are expected of children their age. But we know from other research that if children have access to 2 years of a high quality early learning program, we can turn that around.
You know, when we talk about early learning programs and having children enrolled in something like an early learning program, an ELP, and you've assessed these 5,000 youngsters, are we also assessing the difference between, for example, I'm trying to understand how the study works, between urban 4 to 5-year-olds, rural 4 to 5-year-olds, private EPL, ELP programs, and versus public sort of preschooling? Is that the kind of data sets you're looking at?
So we randomly assessed children in 1,247 early learning programs across the country. And we wanted the sample to be representative of the country's young children, as well as each province's young children. So the data can be disaggregated at a provincial level. It can be disaggregated by sex, so you can look at the difference, which we've seen a difference in performance of boys and girls. And importantly, it can be disaggregated by income quintiles. So we're able to say from the data what the difference is between the performance of children in the poorest quintiles and the richest quintiles. We didn't specifically look at rural-urban divide, but there is an opportunity for us to dig deeper into the data to answer some of these additional questions.
Yeah, and they're good questions to have. I mean, I understand the survey was only done recently, and I think that's a great way to take the survey forward. Sonja, before I say goodbye to you now, what do we do with this information? You mentioned a number of partnerships, and that's great to have the survey done. You've got the survey results. What do we do with it, just before I say goodbye to you?
So there are a couple of things. One is we are working with key partners to advocate for some very key changes, eliminating stunting, increasing budget allocation to early learning programs. But there are also things that people in their homes, in their communities, in their places of work can do. And we've detailed these actions on our Thrive by 5 website. And finally, the intention is to repeat data collection every 3 years so that we're able to track trends and hold ourselves accountable.
And I think that's the whole point. Is it's great to have a data set now, but we need to have them going forward as well to compare and contrast and see if we're moving forward. Sonja, it's an incredible survey. All the best with bringing more attention to it. I really appreciate your time. Sonja Giese from the organisation Thrive by 5 Index, the survey they've done on 4 to 5-year-olds, 65% of them not going to meet, this is shocking, not going to meet their early learning and physical growth expectations.